Let's go ahead and bring in Dr. Jeffrey Schlegelmilch. He's the director of the National Center for Disease Preparedness at Columbia University's Earth Institute, focusing in part on public health preparedness. Jeff, thanks so much for joining us. That's where I want to start. The U.S. seeing a new surge. Did these first peaks prepare us any better for it?
Well, they certainly gave us a lot of information in terms of how the disease spreads. They've certainly taken a toll on the economy and on a lot of families and people's lives and livelihoods. But are we better prepared for the second peak? I think the answer is a resounding no. We have a lot more people kind of getting fatigued with the guidance, with the social distancing. We have a lot of pressure with the holidays, people ready for it to be over. And frankly, a lot of mixed messaging and a lot of ineffective response at the federal level, and even some of the pressures that we see economically on some of the airlines that was just talked about coming from lack of a stimulus, lack of additional resources and funding to help people weather these phases of the pandemic, where the safest thing to do is to stay at home and reduce our contact with other people physically.
We've heard the presumptive president-elect Joe Biden say it's not about a vaccine, it's about the vaccination. Some European countries have already put out their inoculation plans. Are you confident in America's distribution plans? We haven't seen many of them.
Yeah, so, I've personally worked on a lot of sort of state and local plans for a variety of different scenarios, whether it's pandemics or a bioterrorism attack over the last decade and a half. And chronically, the most complex and most difficult piece is that last mile, is when it goes to state and local governments and when they're trying to get it from the laboratory, from the supply chains into your arm. We call it the last mile. And there just hasn't been a lot of great guidance coming from the federal government. The necessary funding needed to plan for this hasn't been coming. A lot of states are working in a deficit because of this. So again, we desperately need leadership, not only from the White House, but also from Congress, to make the resources available to prepare for this. They're going to do what they can. They're going to work off the plans that they have in place and already are trying to figure out how to make this work. But we can certainly be putting a lot more wind at their backs through greater national leadership here.
U.S. health officials are pleading with Americans to not travel over Thanksgiving coming up now. If it's that dangerous, should they and could they take a dramatic measure like grounding flights like they do when there are dangerous storms?
Yeah, theoretically there may be some mechanisms for doing that, but it's really a very difficult option to pursue. In a federalist democracy, there's actually not as much authority at the national level as there are in other forms of government. A lot more is at the state level. There's a lot more deference to the private sector. There probably are some mechanisms for grounding flights, but with it may ultimately do more harm than good. There's a lot of people who have been sort of fueled with rhetoric, calling it a conspiracy, saying that it's not real, and it may just add more sort of fuel to that fire, if you will. I think what's most important is that folks heed the warnings, that they have options to get to each other if they absolutely have to, but to really, really think hard on if it's absolutely necessary, or if you can have a virtual Thanksgiving and find some other creative solutions to stay connected, even if you're not physically present.
Does this sort of decentralization work in a pandemic? We've seen some states and counties return to tougher restrictions. This is a sort of piecemeal approach when it comes to containing a virus.
Yeah, absolutely. And I think from the beginning there are mechanisms and there were things put in place to try to have a stronger national leadership on this in the Obama administration that were either disbanded or moved around by the Trump administration, which has really taken a more traditional federalist states lead approach. The problem is that works for a lot of disasters. It doesn't work for pandemics because they're global, because they're everywhere. You really do need a unified response. And the unevenness in the infections, the unevenness in the death rates is all correlated with the unevenness in the policies, because it's been left to the politics of individual governorships and states, some doing better than others, rather than a cohesive national response, which we hope to see in the transition of government coming this January with President Biden coming in.
Jeffrey Schlegelmilch from Columbia University, thank you so much for your insights.